Hello everyone. Today we are going to learn about Cauti, catheter associated urinary tract infection. Myself Vinoli, lecturer from Tribhuvan College of Nursing. Let's get on to the video. Understand specific objectives of this topic. At the end of the class, students will be able to understand about define the Cauti, describe the epidemiology of Cauti, list down the causes of Cauti, explain the pathogenesis of Cauti, enlist the prevention guidelines for Cauti, and define the care bundle, define catheter care bundle, aims of Cauti, maintenance bundle, and enumerate the principles of Cauti bundle, and explain the insertion of catheter, explain the maintenance of care bundle, and finally coming to the conclusion. Introduction about Cauti. Catheter associated urinary tract infection increase the patient mortality and morbidity and length of hospital stays and cause an economic burden to the healthcare system. The Center for Disease Control and Prevention mentioned that the catheter associated urinary tract infections were the most common healthcare associated infection. Definition. A catheter associated urinary tract infection occurs when the germs enter the urinary tract through the urinary catheter and causing the infection. These risks of the Cauti can be reduced by ensuring that catheters are used only when needed and removed as soon as possible. So catheters are placed using a proper aseptic technique and closed sterile drainage is maintained. What are the impact of Cauti? More than 30% of hospital-acquired infections reported to National Healthcare Safety Network. Estimated more than 560,000 nosocomial urinary tract infections annually reported, and estimated 13,000 attributed deaths annually reported. And the National Healthcare Safety Network reported Cauti rates to be from 3.1 to 7.5 per thousand catheter days in acute care hospital. Impact of Cauti among urinary tract infections acquired in the hospital. Approximately 75% of associated with the urinary catheter. Excess length of days stays 2 to 4 days. What are the causes of Cauti? E. coli 21%, Candida 14.9%, Klebsiella pneumonia 21.4%, and Pseudomonas aeruginosa 7.7%, and Enterobacter 4.1%, Enterococcus 10%, gram-negative bacteria and Staphylococcus resistance to antimicrobial is increasing. What are the risk factors for Cauti? First one is age and gender. The most of the old age people and the female gender, they will be getting the Cauti infection. And prolonged catheterization, the people who is having the long days of having the catheterization, they getting chance of the Cauti infection. And orthopedic and neurology services, like these kind of the peoples, they may be bedridden stages, so they cannot go for toileting, so they need for catheterization, they'll be getting. And metal colonization, urinary retention, incontinence, and lower professional training for inserting the catheterization, and disconnection drainage system, and duration of catheterization, and impaired immunity, like includes diabetes and renal dysfunctions. So these are the risk factors for the Cauti infection. What are the symptoms occurs after the Cauti infection? So most of the people will have fever and suprapubic tenderness and costovertebral angle tenderness and altered mental status and dysuria, which means difficult or painful urination, and frequency of urination, and stanguria in the absence of catheter, which means these symptoms sometimes characterized by painful and frequent urination of small volumes, and sometimes flank tenderness can be seen, and delirium, which means delirium is a serious change in mental abilities that cause confused thinking and lack of awareness of surroundings. What are the complications occurs after the Cauti infection? There are two complications. One is infectious complication and non-infectious complications. Infectious means which includes urinary catheter obstructions, sometimes bladder urolithiasis, like urinary tract stones will be present, and purulent urethritis, which means gonococcal urethritis is usually purulent, and which means inflammations are in the urethra. Most of the females will be affected. And gland abscess for male, and prostatitis, which conditions the prostate gland that cause inflammations and pain and urinary problems as well. And non-infectious complication is include that non-bacterial urethral inflammation and urethral stricture and mechanical trauma and mobility impairment can be seen. Now let's see guidelines for prevention of Cauti. The first guideline is appropriate urinary catheter use. The second guideline is proper techniques for urinary catheter insertion. And third guideline is proper techniques for urinary catheter maintenance. Let's see the first guidelines of appropriate urinary catheter use. In that, there is the two options. One is the insert catheter only for appropriate indications and leave in place only as long as needed. Here, the first to minimize the urinary catheter use in duration of use in all patients, and particularly those at higher risk of the Cauti infection. Then avoid use of urinary catheters in patients for management of incontinence. Then for operative patients who have an indications for an indwelling catheter, remove the catheter as soon as possible post-operatively, preferably within 24 hours, unless there are appropriate indications for continued the usages. Then consider using alternatives to indwelling urethral catheterization in selected patients when appropriate. Here use the external catheter in cooperative male patients without urinary retention or bladder outlet obstruction. Then consider the alternatives to chronic indwelling catheter such as intermittent catheterization in spinal cord injury patients. Then consider the intermittent catheterization in children with myelomeningocele and neurogenic bladder to reduce the risk of urinary tract deterioration. Coming to the second guidelines, proper techniques for urinary catheter insertion. Here, to perform the hand hygiene immediately before and after insertion or any manipulation of the catheter device or site. Then, ensure only properly trained who know the correct technique of aseptic catheter insertion and maintenance are given this responsibility. And use the sterile gloves, tape, sponges, and appropriate antiseptics or sterile solutions for periurethral cleaning, and a single-use packet of lubricant jelly for the insertion. Then properly secure indwelling catheter after insertion to prevent movement and urethral traction. Then unless otherwise clinically indicated, consider using the smallest bore catheter if possible. Then consistent with good drainage and to minimize the bladder, neck and urethral trauma. And if intermittent catheterization is used, perform it at regular intervals to prevent the bladder over the distension. Then consider using a portable ultrasound device to assess urine volume in patients undergoing intermittent catheterization, to assess the urine volume and to reduce the unnecessary catheter insertion. Coming to the third guidelines, proper techniques for urinary catheter maintenance. Here, there is two options following aseptic insertions of the urinary catheter. Maintain a closed drainage system. So, if breaks in aseptic technique disconnection or leakage occurs, replace the catheter and collecting the systems using aseptic technique and sterile equipment. Then consider using the urinary catheter systems with the pre-connected sealed catheter tubing junction. Then maintain the unobstructed urine flow. So first keep the catheter and collecting tube free from kinking, and keep the collecting bag below the level of the bladder at all the times, and do not rest the bag on the floor. Then empty the collecting bag regularly. So finally, use the standard precautions including the use of gloves, gown and appropriate during any manipulations of the catheter or collecting system. Now we'll come to the care bundle. So let's understand definition of care bundle. A care bundle is a group of evidence-based practices that improve the quality of care when consistently applied to all participants. It is defined as a group of interventions related to diseases process that when implemented individually. Urinary catheter care bundle are shown to be effective in reducing the rate of catheter associated urinary tract infections. What are the aims to be maintenance of the care bundle? To reduce the rate of catheter urinary tract infections, remove the catheters as soon as possible and care of catheters individually. What are the uses can be seen using the Cauti care bundle? The first uses is the implementations of care bundles can assist in enhancing the compliance to evidence-based quality process measures to improve the patient care. Then care bundle includes a set of evidence-based measures that when implemented together have shown to produce better outcomes and have a greater impact than isolated implementations of individual measures. Then strong clinician engagement and endorsement will be there, and then bundles also help to create reliable and consistent care systems in hospital setting. There is a general principles of Cauti care bundle. So first one is each element must be implemented collectively and be adapted to the local setting appropriately followed, and healthcare providers are advised to follow the each bundle elements by all members of the healthcare team involved and develop and promote positive habit forming behavior among providers and ultimately reliable care processes. Insertion of catheter. There is a universal precautions to be followed the insertion of catheter. There is the potential for contact with the patient's blood and body fluids when working with the catheters. These risk increases the experiences of operator, and this is a sterile procedures and should be treated as such. Applications for the catheterization. Foley's catheter insertion allows us to try and decompress, obtain the specimen or irrigate the bladder. This will allow you to treat urinary retention, bladder outlet obstruction, evacuate clot and monitor the urine output. In some cases, as urethral stricture or prostate hypertrophy problems, so the incisions will be very difficult, so may require the consultations with urology doctor. Equipments for the catheter insertion. The first cleaning solutions examples betadine or aqueous sterile gloves, consider universal one, and sterile draper and precautions chlorhexidines and cotton swabs, forceps, sterile water and syringe usually 10 cc, and Foley's catheter usually 10 to 16 to 18 French, and lubricant water based jelly or xylocone jelly can be used. Coming to the catheterization procedure. So the step 1 is explain the procedure to the patient, gather the equipment and open the catheterization kit and catheter. Assess the patient into supine position with the legs spread for men and patients truly flat, and in women feet together or frog leg position. And if male patients retract the foreskins and put on the sterile gloves and do not check the balloon for patency, inflating altered the contour and can make incisions more difficult and uncomfortable. Then generously coat the distal portion 2 to 5 centimeter of the catheter with lubricant. Then remove the cap on the syringe containing sterile water. You can choose to attach the catheter now after you have successfully inserted. Then discard all experts to cotton swabs indicate, and you don't need them. Soak up the preparations and pour the pre-op cotton swabs. Identify the urinary matters and gently insert. And for women, until 2 to 3 inches beyond where urine is noted, and for men, until the hub of the catheter reaches the meters to the hilt. And for inflate the balloon using correct amount of sterile liquids, usually 10 cc, but check actual balloon sizes. Then gently pull catheter so that the inflation's balloon is snug against bladder the neck, and connect the catheter to drainage system. Secure catheter to thigh with a bit of slack, and remove the gloves, dispose equipment appropriately, wash the hands, and document size of catheter, inserted, amount of water in the balloon. Now, catheter management technique. So first we should do the antimicrobial prophylaxis, then urinary aseptics things, and bladder irrigation, aseptic antiseptic installations in the drainage bag, and periurethral care, routine catheter or bag changes, and catheter lubricants, securing the devices, bacterial interferences, catheter cleansing, and catheter removal of strategies like clamping, free drainage prior to removal or post-operative duration of catheterization, and assessment of the urine volume. Catheter removal strategies. Evaluate post-wide residual using the handling ultrasound, and high PVR is not equal to retention, and take into account while wider volume and symptoms. And if PVR over 300 ml, considers alternatively drainage, and if empty, assess volume status. Coming to the conclusion. Catheter-associated urinary tract infections were the most common healthcare-associated infections. A catheter-associated urinary tract infection occurs when the germs enter the urinary tract through the urinary catheter and cause of infection. Urinary catheter care bundle are shown to be effective reducing the rate of catheter-associated urinary tract infection. Hand hygiene was performed before and after client contact. Gloves were used to manipulate the catheter and drainage system. Catheter is unclogged sterilization device. I hope this video will be useful for everyone. Thanks for watching.